corresponds to the second part of Lecture 7 on abnormal ECG. The previous part will be covered in a previous podcast, and hopefully we'll have done it in lecture. We will begin on page 30 in your lecture manual under some typical causes of abnormal ECGs. We're going to be covering the major ones: hypertrophy, bundle branch blocks, and I'll kind of put them together: ischemia, injury, and infarction. First ones we're going to be doing is hypertrophy. The hypertrophy and bundle branch blocks, they both have in common in that the QRS complexes are prolonged in them, indicating the ventricles take longer to depolarize, but there'll be a difference in their configuration and some other little aspects. When I've finished with hypertrophy and bundle branch blocks, I'll go over with you again what they have in common and how they differ, because it's very important to understand how certain conditions, what they have in common and what differentiates them from each other. And those are good exam questions that I like to use. Is like, can you tell me what they have in common? Can you tell me what they have different amongst them? So the first thing is going to be hypertrophy. Hypertrophy can be a result of increased workload on the heart, and specifically we're going to be looking at right and left ventricular hypertrophy. So for some reason the ventricle had to work harder over time to try to maintain efficiency. The ventricle began to hypertrophy. An example of left ventricular hypertrophy would be a result of sustained hypertension in the systemic circulation, or say something like aortic stenosis or aortic regurgitation, valvular defects, which we will also cover this trimester. Right ventricular hypertrophy can be a result of pulmonary hypertension, or say pulmonary stenosis or pulmonic regurgitation. Those again are valvular defects. So both of them are a result of increased workload demanded upon the heart. What you will see over time is hypertrophy can result in ECG changes. And so we're going to be looking at what effects they have on the EKG or ECG. Hypertrophy is associated with a prolonged QRS complex, or duration of the QRS complex, which indicates that the ventricles took longer to depolarize. So example would be a duration of the QRS complex of greater than 0.09 seconds. A normal QRS duration is between 0.06 and 0.09 seconds. The configuration of the QRS complex will be completely normal because the conduction through the ventricles are still within the normal cardiac conduction system. So the QRS configuration itself will be normal, it's just the duration will be prolonged. We'll use an example of left ventricular hypertrophy, which you see to the left of your screen, where you'll see that we have drawn a vector that is kind of shifted up towards that person's left. A normal vector should be down a little bit, kind of anywhere from between 0 and 90 degrees. So the kind of the average vector is around about 59 degrees, or if we could use the term a mean electrical axis, which indicates the average direction of depolarization through the ventricles, is somewhere between 0 and 90 degrees. But someone with left ventricular hypertrophy, their left ventricle is much bigger than normal. That side will take much longer to depolarize than the right side. So on average, you're going to be spending more time depolarizing the left side. The vector is shifted towards the left. Instead of coming down this way, it comes up towards the left, and so you will have a mean electrical axis that's less than 0 degrees. That constitutes a left axis deviation. In addition, with left ventricular hypertrophy, you will see what we constitute as a high voltage ECG. Anytime you have more muscle mass, more muscle mass means more electrical activity. Your QRS voltage will be larger. With left ventricular hypertrophy, you could have if you, for example, may have the QRS complex, the voltage be over, say, 20 to 25 millimeters, or actually not really voltage, that's the size, but that would constitute over 2 or 2.5 millivolts overall in lead 2, or you can say if I sum up the voltages from lead 1 and leads 3, they should be equal to lead 2. So what you'll see is pretty high voltages in your ECG. And we'll show you an example so you can kind of see it. You will have the left axis deviation. With left ventricular hypertrophy, you also will notice that sometimes you will see inverted T waves. The inverted T waves represents where any time that you may have the ventricles take much longer to depolarize, the part of the muscle that was the first to depolarize will come out of its refractory period and then be the first to repolarize, and you'll see the T wave in the opposite direction of the QRS complex. In particular, in this case, would be, say, the R wave. You don't necessarily see that as much with right ventricular hypertrophy. It's more common with left ventricular hypertrophy. The right ventricular hypertrophy, you will still have a QRS duration that's prolonged. The configuration will be normal. You will have an axis deviation, but this time the right ventricle is thicker. On average, that side of the heart will take longer to depolarize, so the vector is shifted to the right. So it's going to be greater than 90 degrees. So if you have a mean electrical axis greater than 90 degrees, you will associate that as one thing you can associate with a right ventricular hypertrophy. The voltage is never going to be what you see with left ventricular hypertrophy. So unless you had a previous ECG on that person, you may not notice that, oh, their ECG is a high voltage ECG. But what you'll notice with people with right ventricular hypertrophy, that if you look at the chest leads, you will have an R wave in V1 and an S wave in V5 or V6. Now normally, in a normal EKG, V1 you'll have an S wave. In V5 and V6 you'll have an R wave. So this is kind of opposite than what you would see in a normal EKG. And I have examples to kind of show you. Here is an EKG taken from someone with left ventricular hypertrophy. A couple things I want you to notice is, one, these kind of look a little bit higher voltage. Now it's kind of hard to kind of count the number of squares, but this is relatively a high voltage EKG. But I want you to just concentrate on the standard limb leads 1, 2, and 3. What you will also notice is, look at the predominant S wave in lead 3. In normal EKGs, you should have a normal mean electrical axis, where you should see QRS complexes in 1, 2, and 3. Overall voltage should be positive, but you see a lot of negative voltage in lead 3. If you had plotted this out, you would have gotten a left axis deviation from this person. But the quick, down and dirty way of trying to determine someone may have an axis deviation is to look to see if you see a lot of negative voltage in any of your chest leads, or not your chest leads, any of your standard limb leads. I see a lot of negative voltage in lead 3, which would indicate a left axis deviation, which you would see with left ventricular hypertrophy. Unfortunately, it would probably be very difficult for you to count the boxes, but these QRS complexes are also prolonged. So we see a prolonged QRS complex, kind of higher voltage. You have a left axis deviation. Now I don't want you to concentrate on the chest leads. It's a little bit more difficult, but the chest leads also back it up. Here is an EKG with someone from right ventricular hypertrophy. What you'll notice here is, look at standard limb lead 1. You see a pretty big S wave in lead 1. You normally won't see that. That's probably telling me, I may have a bit of a right axis deviation, which is associated with right ventricular hypertrophy. I did not magnify this EKG as much, but the QRS is prolonged. But what I wanted to use this EKG for you is I do want you to look at the chest leads. Here in V1 and V2, you see R waves. You should not see that. Normally you would see S waves in V1 and V2. And eventually in a normal EKG, V5 and V6, you would have an R wave. In this person, you don't see it as much, but you don't see an S wave over here, but what you do see is the R wave. We never get ideal. It's very difficult for me to find ideal EKGs, but this is kind of unusual in that you see a R wave in V1 and V2. Normally you would see an S wave. I was trying to find you a good one. It was very difficult for me to find you one where also you saw the S wave in V5 or V6. But this one, no, that's more the 2. It was difficult for me to find it for you. Now the bundle branch blocks. Here, bundle branch blocks, you still have an issue in the ventricles taking longer to depolarize, but the cause is a little bit different. In hypertrophy, you just have more muscle mass. With a bundle branch block, you have a block in the conduction system, and specifically the bundle branches. We're giving you examples of where we have a block in the right or left bundle branch, and they're going to be complete blocks. So on the left of your screen, we're showing you a block that's shown in black, a blockage of the left bundle branch. In reality, that left bundle branch actually has more than one branch, but we're showing you if we have a block in the bundle before it branches into the fascicular block, or the fascicles. Here we have a complete block in the left bundle branch. So what's going to happen is when the impulse comes down to go to the ventricles, the right ventricle will have no issue in depolarizing because the right bundle branch is perfectly fine. But because there's a block in that bundle branch on the left side, the impulse is going to have to travel myocyte to myocyte, maybe coming over from the right side to the left side. It's going to take much longer to depolarize the left side. So what's going to happen is, I've tried to draw on for you on the screen. In the black, this represents the QRS complex that you'd say from the right side depolarizing. Depolarizes perfectly fine. The left side is going to take longer, so I show you in red. The left side then depolarizes, so what you see is a double depolarization. And what eventually occurs is you don't see the stuff that's in the middle with the right and the red and the black together. What you see is what you see up on your screen in lead 1 is kind of this bizarre looking R wave. Okay? And so what's happening is you're seeing separate depolarization of the two ventricles. When everything is normal, the right and the left ventricle depolarize at the same time, so you just see that one R wave. But here you see the double depolarization. So what happens is you get a bizarre configuration of the QRS complex. So that is what differs from a hypertrophy. Hypertrophy of the QRS configuration is normal. But how they have in common is that the QRS duration is prolonged. So the QRS will be prolonged, but generally it's usually a little bit longer with hypertrophy, but you may not always see that. So on average with right ventricular hypertrophy or left ventricular hypertrophy, you may have a QRS duration of say 0.1 to 0.12 seconds. With bundle branch blocks, often it may be more than 0.12 seconds. But I don't want you to always say that it can't be hypertrophy because my QRS duration is 0.12 seconds. You need to be able to say the QRS is prolonged, plus you need to differentiate, is the configuration bizarre or is it normal? Okay, but generally bundle branch blocks the QRS duration is a little bit longer, usually greater than 0.12 seconds. Bundle branch blocks are also similar to hypertrophy in that you do have axis deviations. So if we use the example what you see over here again with the left bundle branch block, the left side of the heart is going to take longer to depolarize, so the vector will be shifted towards the left and maybe start shifted up towards the left here. And so on average it's telling you the left side is going to take longer to depolarize. The vector is shifted to the left. You will have a left axis deviation with a left bundle branch block. So you would have a mean electrical axis less than 0 degrees. Now with a right bundle branch block, so here you have a block in the right bundle branch. The left side will depolarize normally. The right side is going to take longer than normal to depolarize. It's going to be going cell to cell. You will have a right axis deviation. So the right side of the heart is taking longer to depolarize. So the mean electrical axis will now be greater than 90 degrees. With a bundle branch blocks, you may also have inverted T waves. Predominantly, you will most likely see it with left bundle branch blocks, but you also will get inverted T waves, just like you would see, say, with left ventricular hypertrophy. So, if we want to make some sort of a list or column to say what do these things have in common, how do they differ? Bundle branch blocks and hypertrophy, what they have in common is prolonged QRS durations. They both have axis deviations, and they both may have inverted T waves. How do they differ? Is bundle branch blocks, the QRS complex is bizarre looking. They have what I call the bunny ears. Bundle branch blocks, bunny ears, or bizarre bunny ears. The QRS durations are usually a little bit longer, but the biggest difference between the two is the configuration of the QRS complex. You will also notice with the left and right bundle branch blocks that what you see in the standard limb leads a little bit different, but I don't want you to have to memorize that. And often sometimes if you look at your standard limb leads, it's difficult sometimes to even notice that, oh, they look bizarre. It's not kind of just doesn't stand out for you as much. You'll say, oh, they may look prolonged. So often, I mean, most people don't just run a standard limb leads. You usually run a 12-lead ECG. So what I want you to notice is a couple things. I want you to look at this ECG and see if you can figure out, is this a left or right bundle branch block? So I'm already telling you it's not hypertrophy, it's a bundle branch block. If you look at your standard limb leads, one thing I want you to look at, do you see overall negative voltage in any of your standard limb leads? If you see overall negative voltage, you may have an axis deviation. So you'll notice in standard limb lead 3, you see a more negative voltage, and it's kind of backed up in lead 2. So this would be suggestive of a left axis deviation, which would tend to signify a left bundle branch block. And if you can on this one, because this one is not a real one, this is one that was actually computer generated, but you do see the bunny ears. Okay, you do see bunny ears, so I'm like, oh, it's a bundle branch block. But a good way to really back up, is it left or right, is to look at your chest leads. V1, V2, 3, 4, 5, and 6. The chest leads, remember, are right over various regions of the heart. It amplifies the problem. So if you look at V5 and V6, you notice those bunny ears standing right out at you. And V5 and V6 are located over the left ventricle. So this would be a left bundle branch block. If you saw bunny ears in V1 and V2, and V5 and V6 look perfectly fine, then you would say, oh, That's probably a right bundle branch block. Another kind of quick way that sometimes they teach people of determining is it a left or right bundle branch block is to look at V1. If you go from the J point in V1, which would be right here, if you move left from it, move back from that J point into the QRS complex, if the terminal portion, say the last 0.04 seconds of the QRS complex, is upright, that's a right bundle branch block. If it's a downwards deflection, it's a left bundle branch block. So you see this one is a downwards deflection. That's another quick way of kind of determining if you've got a right or left bundle branch block. To me, it's easier. Look at where you see the bunny ears. That's the easiest thing for me. So you have, if you had actually counted the squares for the duration of the QRS complex in this EKG, it is prolonged, very prolonged. It's bizarre looking. You have a left axis deviation, and you see the bunny ears in V5 and V6. This is a left bundle branch block. In lecture, I will bring you in a right and left bundle branch block, and they will be real live EKGs obtained from people, students who had family members that had them. They gave them to me. I'll show it to you and see if you can tell me, do you think this is a left or right bundle branch block?